to get on the schedules to get everything installed, and then you have to go through testing, and then only after everything is good and well and done can you submit your reimbursement. So we have a lot of folks in that category. So a lot of people have completed pretty much everything. They just got to get us the paperwork. They're in the testing phase, and as soon as that's completed, they'll be able to send it through. So I expect by next meeting, or maybe even the next meeting, we'll see a fair chunk come in. We'll be well above our time.
Okay. Well, super. I appreciate that. I know y'all have worked a lot on that. I know all these entities have worked on it. So that's the goal, was to get to the finish line. So, all right. Thank you. Appreciate it, Noah.
Thank you.
All right. Up next is number 4, rulemaking. Consider adopting amendments to rules 252.2 through 252.3 and 252.5 through 252.9. And that would be Kenny.
Thank you, Commissioners. Kenny Moreland, CSEC's General Counsel. I do want to just quickly note, I think we have our YouTube feed working now, so all of the items that are up for actual deliberation, anybody following from home will get to listen and watch. So if you could please turn to page 15 of your notebook, we are going to discuss adopting amendments to certain rules in Chapter 252. As you're aware, the Commission previously voted to propose these amendments at the meeting on November 18th, 2025, and notice of the proposed amendments with the new text was published in the Texas Register on December 5th, 2025. Comments on that proposal were requested by January 5th, and on that final day of the comment period, we did receive comments from the Texas 911 Alliance. You can see those comments on page 17 of your notebook. You've also had the chance to review those comments prior to today's meeting. The Alliance's comments relate to just some specific amendments in this group. As Commissioner Beecham noted, we have 252.2 through 3 and 252.5 through 9. These comments only relate to one rule, 252.8, which deals with the Emergency Communications Advisory Committee, ECAC. Specifically, the Alliance opposed the amendments that would change CSEC's executive director from a permanent non-voting ex officio member of ECAC to a permanent voting member. And they stated that such changes were against the letter and spirit of the law. And if such changes were made, the Alliance proposed in the alternative to add its chairman or such individual's designee as an additional voting member to ECAC. And we also received public comments after the 30-day comment period from several parties, MECTA, TARC, and Greater Harris County 911, regarding that same proposed amendment, 252.8. Those comments were not timely under the rulemaking process. Comments must be submitted within the 30-day period to be included in that process and be addressed in the Texas Register. But they are timely for the Commission to consider as public comments on an open meeting agenda item. We made those comments available to you as handouts to your notebook prior to this meeting. They were also posted to our website for anyone following on the YouTube broadcast. And we also made printed copies available as handouts to anyone interested as they entered today. I'm going to quickly summarize their comments since they are not addressed in my proposed rulemaking document. MECTA joined the Alliance in raising policy reasons against CSEC-CD becoming a permanent voting member, but opposed the alternative proposal of adding the Alliance's chairman. TARC supported the amendments as proposed and separately joined MECTA's opposition of the Alliance's alternative proposal. And then the most recent comments, GHC, also opposed CSEC-CD becoming a permanent voting member based on certain policy reasons. And they, similar to TARC, opposed the alternative proposal from MECTA. Just to complicate it slightly further, GHC proposed its own alternative of avoiding a tie by limiting votes for the current membership to allow only one of two members from each of the RPCs, MECTA and ECDs. Basically reduce the votes from 3 from 6 to 3. That's the playing field. So just so everybody's aware. I have reviewed all of those comments and discussed them with Andrew and agency staff. I understand some of the concerns raised that oppose the changes to Rule 252.8, but I do respectfully disagree with those arguments, especially those claiming that these changes do not comply with the law. We continue to believe that these changes that we've proposed are firmly permitted by the law, and they also will not hamper the committee's narrow purpose and will benefit CSEC and statewide 911. Now, my detailed arguments addressing each of the Alliance's points are included on the document that I prepared for your consideration on page 21. That's the document that would potentially be published in the Texas Register. It ultimately, if adopted by the commission, would adopt the changes as we originally proposed without changes. I do also want to note at this time that these proposed changes, before they came to the commission for consideration, were provided to the governor's office. The governor's office is required to review all new rules and amendments prior to publication in the Texas Register, and the governor's office had no concerns with our changes. If they believed that they were not in accordance with the law, that was their opportunity to tell us so, and they have availed themselves of that opportunity and did so for CSEC in 2023 when CSEC was considering the repeal of the Poison Control Coordinating Committee. That repeal was then withdrawn. One final note on that document for publication that starts on page 21. I received a question from one commissioner on one of the statements on the comments from the Alliance. The first comment from the Alliance reads, "The current rule faithfully implements the relevant statute establishing the committee's membership." Now that is close to verbatim taken from what the Alliance stated. You can turn to page 18 if you'd like to see their statement, but they wrote, "Current Commission Rule 252.8 faithfully implements this statute." Just so everyone's clear, the implication of their comment is that our proposed rule change would not faithfully implement the statute or not as faithfully implement as our current arrangement. My detailed response that follows that explains why I disagree with that implication and provides my support for that position. Okay, so that's everything that I've prepared to summarize the situation. So in conclusion, I would recommend that the commissioners vote to approve the document on page 21 for publication in the Texas Register, which would adopt the amendments as proposed without changes. Before that, I'm happy to answer any questions any of the commissioners have or provide any additional information to help facilitate your deliberation regarding this rule change, which would add the executive director as a voting member to ECAC along with the 6 other current members.
One thing real quick, do we have anybody, I know we have written comments from everybody already in this, but is there anybody here today that's wanting to testify on this item? Okay, well that simplifies that. I just want to make sure of that first. Okay. Any questions?
I have, go ahead, Joe.
You first, Richard. Go.
First, I had a comment. Kenny, I thought you did a really good job at refuting the legal arguments. I think there may be policy questions, but I think the legal arguments are very solid, and I thought you did a really good job on that. I do have one question. Is it possible to take up this item in 2 motions where we dispose of the rules where nobody objected to it and then take up 252.8 separately, just so it doesn't get confusing that whichever way we go, we're not forgetting about the other rules where there were no comments?
Yeah, so to clarify, I did mention earlier there are many rules being touched as part of our proposed changes. The comments and the expected deliberation is going to be only on 252.8. We will only publish one document in the Texas Register, which is why this is all lumped together. So ultimately, we will need to have a single document that says what we're going to do on 252.2 through 3 and 5 through 9, including if we decide not to adopt changes to 252.8 or to adopt some different change than what is written in my document. But I think for the convenience of the commission, you could entertain a motion to address 252.2 through 3, 5 through 7, and 9, which we have no comments on. I think we expect to adopt without changes and then take up consideration of 252.8. Ultimately, just for clarity, I will need to put all of that back together in a single document that goes to the Texas Register and explains what we're doing. But the commission can certainly address those two separately rather than all as one big motion.
I would move to address them separately if possible.
Richard, can I ask you a question?
Yes.
Does it really make a difference? If there's no questions on the other parts, then we could just deal with it all as one. I don't think it'd be too confusing.
Okay.
If there was other ones that there were questions on, but since it's submitted all as one deal,
Okay.
does that make sense? Unless anybody's confused or having issues there. Okay. Chip, you had some questions, I believe?
First of all, thank you. And I want to apologize that when this came up at the last meeting, I did not study the rules carefully enough and think through all the implications to raise an objection then. So I'm glad I still have that opportunity to. For the change, what was the impetus? Was there perceived to be a problem with the structure of ECAC and the way it was working and it needed a tweak? Or was it just a review and it said, we might want to make this change?
I think there was an understanding that the executive director has an opportunity to give input, but is not necessarily that input does not have to be heard and is not actually formally registered in any way if it is ignored. So in the event that the committee took up a vote and voted in favor of something or against something, there's no record of whether CSEC's executive director was in agreement on that or not. And so there was a belief that adding at least a formal position for those items would benefit CSEC and statewide 911, and a higher level of participation that comes with that voting right felt like an improvement in allowing CSEC to make its statewide position more heard on the committee. Some committees do not include the body that is advised, but there are many out there that do. Mm-hmm. I note one of them in my response, and the Alliance noted it as well. It's a 7-member committee with one currently ex officio member. So adding a single vote from the executive director would not suddenly give a majority to that statewide position, but it does allow a vote that is currently silent. And I will also note that the current membership goes beyond the statutory minimum. There are 3 members outlined in statute that must be included. The statute says at least the following, and it lists 1 member representing RPCs, ECDs, and municipal ECDs. The current structure includes 2 members each. So staff felt that this was a change we could make to improve the committee's output, ECAC's output, by having a formal opportunity for the executive director to contribute. And I think I have not personally sat in an ECAC committee, an ECAC meeting. So Andrew also may be able to speak to it as well. But that is my understanding of the benefit of the change as proposed.
Exactly what Kenny just said. I would also add that the impetus of this entire process is the agency is required to undergo a 4-year rule review. ECAC's rule was up this year for the review under the statutory requirements. We reviewed it. We have an even number of votes, 6 votes, 7 members on the committee, it seemed to me that one of the easiest ways to get to an odd number in case there ever was a tiebreaker would be to add that additional vote as well. So as Kenny said, it allows me to be more of an active participant than a spectator in the process, as well as give us some sort of tiebreaker if that situation were ever occur.
Is there any feeling that ECAC is not working as it's currently constituted? Is it not doing its function? Because I'm of the opinion that if something's working, you don't really need to adjust it or tweak it. A simple change in the composition of a body can have unknown, unforeseen, and unintended consequences. And if it's working, I like it. I think the tiebreaker on a advisory committee is really not an issue to me. In fact, if there were a tie, that would be interesting information to pass on to the commission as part of its recommendation. It'd be very interesting to see how a tie was actually constituted among a group like that. So I'm not concerned about a tiebreaker on a committee that makes recommendations and provides information. But I am concerned about changing the structure of a group that has been working for us.
I'll weigh in there a little bit, Chip. So when we originally had this, I didn't think a whole lot of it. Then we started getting the comments back, and I started reading those. And that first set of comments was pretty, there was a little extra pepper on that, if you know what I'm saying. So I spent a little time looking at this, and I do have a concern about the committee and why we have it. I realize it's in statute, and we implemented that. The commission could have not implemented it the way the statute is written, but we did. But if you look at the statute itself, go back to the actual statute, not our rulemaking, the statute. This committee was formed for one very specific, focused thing, and that was the establishment of the SINet, which does not exist, which is not going to exist, I don't think, anytime in the near future. So at that point, this committee really lost its purpose, per se, under statute. It has continued to operate as sort of an advisory group out there, but again, it's not to its statutory purpose that it was formed. So flash forward. We did use that committee to run Proposition 8 through, to look at that and work on distribution methodologies. But think about that for a minute. I think this commission was pretty clear when we did that of, look, there's got to be some parameters, some accountability on this. And what did they do? Brought it back with absolutely nothing. Just transfer the money to us. Flash forward again. They tried to use it as an opportunity to lobby for a fee increase, which I understand a lot of people won't. But a government statutory committee is not the place to do that. That's some other violations of state law there. And so as the committee exists today, I have a little bit of concern on what they're actually working on to advise and guide us on. I don't think this commission, outside of that one item on Proposition 8, has really ever given them a charge to work on. In addition to that, then you have a strategic alignment committee that we have, which is essentially the same thing. Again, that's under our own bylaws. That's not under statute there. But as you look at all of that, it makes me kind of wonder, number one, why anybody is really concerned about who's voting on it. It has no legal standing per se to, you know what I'm saying. It's advisory solely in nature. But as I look at that, if it's going to advise us on other things outside the ESINet, we have a program that regulates COGS. Why should the COGS not have more of a voice on the things that we're doing to regulate them as opposed to splitting it out amongst municipals and alliances? Not that they don't have a lot of good information and input, but you know what I'm saying, just from the outset of representation, you would think those COGS would, it's more to their benefit there. And so I think there are a lot of issues in this. I think probably we really need to look at this committee a little bit more, if it's really needed, or if it's needed in this particular form, if it should be opened up. But as we go through that process, I would like there to be some input on the record in case we pull the stunt again about let's have a fee increase and use this committee as a standing point for it. I think we need to have a little bit more control there. I think it's also, while we want their input and we're not trying to diminish their input, I think it does help to have the participation of the agency, because again, this is not about an ESI net anymore. It's really about policies and procedures of this agency. And so I do think there has been some change from when this was originally done to now that factors in there.
Okay, I would disagree with your characterization that it was an attempt to lobby for a fee increase. There was a statement that revenue needs to increase to match the 911 expenditures, very similar to the Rider 9 report prepared by the commission. So other than that, I agree the ESINet is not going to probably ever exist. And if that is the only reason why we have the ECAC, then we might need to revisit the whole thing altogether. But I do like the idea of having a standing committee to give us advice on statewide 911 issues, not just the state program. And if we're going to have one, I like the way it's constituted currently.
I think there needs to be something. I don't know if we need a strategic alignment committee and an ECAC. I think that's probably a little duplicative. Have one. I think more recently, one thing they did talk about a lot was the FIFA stuff. And I think at one point, the Eclipse? Yeah, I think that's the word for that, the Eclipse. I don't know that really that brought anything back to us as a commission. Those are not items that we took, but it was sort of a, what do you want to call it, a gathering place, coffee club. Let's all get together and talk about these things. And I do think there's probably a benefit from that. But is it in the current format under a statutory committee for the ESINet? Does that need to be updated? Can we do it as one as opposed to two? I think there's some things to look at there.
Agree. There is a lot of overlap between the two.
Two comments. One is for the purpose of the committee. Even if there's not going to be a specific statewide ESINet, I think it's important to ultimately have those functions as if we have a statewide ESINet. In other words, if we have 5 or 6 ESINets, they need to work together as if they were one. And I think that's something that ECAC at the appropriate time should be doing. And the other thing I would, right now, the presiding officer of ECAC has always been the commission's executive director. And that has been by vote of ECAC. And I don't know if that was chosen because no one else wanted to do it, or it's because as a non-voting member, people thought that was an appropriate thing. And I don't know if ECAC could address some of this in their bylaws, maybe strengthening the presiding officer, addressing the tie vote. I think there's probably several ways to do it, and I think it is probably a good idea to study it and maybe commission have more direction to ECAC, specific things that we want them to look at, such as perhaps the interoperability and when it will be achieved or what they're doing towards that. Thank you.
So just to clarify, Richard, you're proposing to leave the statute as is without a voting member? Is that, or the ED is a voting member?
Truthfully, I think either way it could proceed the same. And so I don't feel strongly, whether we decide to keep it as is for now, let them look at their bylaws and then take up its purpose, or whether we make the change. I can see pros and cons both ways, so I'm really undecided about whether to make that change at this point. But I think it is important, as the chairman said, to nail down what we expect ECAC and what we ask them to do. And if we haven't provided them the specifics and they go off on things that maybe we wish they hadn't, maybe we could address that by providing more specifics to them.
Absolutely agree that we need to do a review. And I was thinking that, you know, the chair has perfect opportunity as the lead on the legislative working group in which to bring this up and consider that on the legislative working group's agenda. But that doesn't get us to where we need to be today on the issue on this statute or this rule. Again, I'm with you, Richard. You know, this is a very narrow statute. And is it going to, my concern is, you know, are we going to do something again that you brought up, unintended consequences? I don't think giving the chair or giving the ED a vote is going to make any significant difference. Having read the minutes of the ECAC over the last 2 or 3 years, I don't see that that's going to make a material difference under the current statute. I come from the municipal government side where I rely on committees. I know Clinton, you do too, where we rely on our planning and zoning commissions to give us input. One of the things that I would like to see in the ECAC is to, when they are voting, I'm not sure who's voting because it just says who made the motion and who seconded it and unanimous or whatever. I don't really know who voted and why. You know, again, you talked about bylaws. I don't know if ECAC has bylaws or governance.
They do.
You know, the governance that, but, you know, you can do some guardrails on a voting ED within those bylaws where the ED couldn't serve as the chair or the vice chair, or they couldn't, or that you require that the vote count be submitted back within the minutes with the ability to have a majority paper and possibly even an option for a minority paper where the commission would understand all the issues that were discussed and why the vote happened that way. That's really what we need to understand. It's not about the vote. It's about the voice. It's about making sure that we've considered everybody's input in making a right and good decision for future commissions and future ECACs. So that's the goal today, is how do you get the voice heard? How do you put things in place that would allow the voice to be heard? Quite truthfully, giving the ED a vote, I think gives a voice because the person that is the ED is at the heart of what's going on. And they're also representing the other interest of and making sure that we get that voice. So those are my thoughts. You know, I'm still gathering, you know, how we unravel this today, but that's my bigger thought.
And to add to that, one of the compromises that I thought of was making in fact, I even drafted a motion that thought about is whether the ED would become a voting member, but only in the event of a tie. This way, making more of an incremental change and not going completely one way or the other. Just trying to keep everybody working together, you know, and then if we need to make more changes after that. I don't know if that's better or worse than the other proposals. I think ultimately, I think it's going to work pretty much the same regardless of which we choose. And therefore, I'm not being on ECAC, and like Kenny, I think I've been to one ECAC meeting a couple of years ago, so I don't really know how it's operating. And I agree with you. I wish their minutes were more detailed because they really don't show us much.
I have a legal question for Kenny.
Yes.
If the commission decided to do the vote today,
Mhm.
and we wanted to see some type of proposal in their bylaws, can we direct that, or does the ECAC set their own bylaws?
I believe ECAC has created their own bylaws. The presiding officer sets the agenda for their meetings and calls the meetings, but they are appointed by the commission and are constructed to advise the commission. So I think it is within the commission's purview to recommend that ECAC evaluate its bylaws or institute some other guardrails in its bylaws. And I did want to mention one other thing. There's been some discussion about some type of review. Our rules, this was not touched in the proposed changes, but the rules do call for an evaluation annually of ECAC. I would have to go back and check notes on what month of the year we conduct that annual evaluation. I would assume it's near the end of the fiscal year. But the commission is directed to annually, or states it will annually evaluate the committee's work, usefulness, and the costs related to the committee, including the cost of commission staff time spent supporting its activities. So there is some annual review that will happen even without adding this to the docket of the legislative working group, but it may not constitute the type of review that Commissioner Beecham is suggesting.
Well, and Kathy, along those lines, because we review annually the Poison Control Coordinating Committee, the Strategic Alignment Committee, ECAC, and I think there's another one. I can't remember what it is. Internal audit. Well, and for the last 22 years, the report is always the same. Sure, great, good. And I don't think we've ever really looked at it. I think we just kind of plow forward. And so it may be good to look at some of those things a little bit more.
It's been more about the cost of going to the meetings. It's been more about how many meetings. It was more of a numbers review more than a principle review or a policy review.
Well, and two, I think the commission, going back, has always understood there is a certain benefit to bringing all the entities together. Was it this? Was it strategic alignment? Whatever it was, that there needs to be some venue for that, to keep an open line of communication, to keep people informed. But how you do that, how many times you do that, So I think, but again, in the past, rather than ruffle feathers or anything, we've just always, sure, absolutely, yeah, let's continue. It's not a big deal. So, but I think in the age of DOGE and everything else, now we've got an efficiency audit, there's sunset in 29, maybe it pays for us to look at some of that and have a, better venue that is specifically stated to what the purpose is as opposed to something else.
Well, I'll throw out a motion then.
Before you do,
Okay.
let's see if we've got any comments down there.
Question on that. So we do this today. To me, it doesn't look like it's going to change much, and may even give us an opportunity to reach in and decide, or have some kind of discussion around what do we really want? What kind of? I mean, I agree there needs to be some, kind of a grouping of minds together to say, hey, this is the direction we want to go, and this group that to some degree, but maybe some folks that are in a little bit different position or expertise or something that I might not have, are able to go ahead and put that type of committee together that fits more of our need today. And so, I mean, I like the thought and like the fact of having Andrew or the ED in that position because of who we really are. This is designed to. It's brought together to take care of those RPCs, the COGS themselves, and just like the thought of having somebody with that specific call from the ED's perspective, being there with that ability to vote on that myself. So yeah, that's how I would think on that.
Got Vaughn and Ryan over there. We don't have many controversial items, so I'm just trying to make sure everybody got their say. All right, sorry, Kathy. Back to you.
All right, back to me. So I've got to figure out how I'm going to do this as all-inclusive here. So I make the motion to adopt the amendments to the rules 252.2 through 252.3 and 252.5 through 252.9 as proposed, and encourage the ECAC committee to adopt parameters or bylaws that would put governance safety rails into their bylaws.
Okay.
Leave that up to them, how they want to do that. And I can give you a list of about 4 I thought of.
There you go. There is a motion. Is there a second?
Muscat, second.
There's a motion. There's a second. Any further discussion?
Yeah, Van Steenberg would like to make a amendment to the motion, just for clarity's sake,
Okay.
if this is procedurally correct way to proceed. I would like to make a motion to amend the motion to make no changes at this time to Rule 252.8.
Okay. You've made a motion to the motion. Is there a second to your motion? There being none, your motion is pulled. Back to the motion at hand, that there is a motion and a second. Is there any further discussion? Being none, all those in favor say aye.
Aye.
Aye. Any opposed say no.
No.
All ayes except for Chip, no. Okay. Not to extend this any further, but we will move this to the legislative working group to kind of look at that. As you stated, I think that's super, and we'll get that going. The other thing that I would ask for staff in our ECAC minutes, if whatever votes there are, if we can break that out by who voted, and not to go overboard in our extra reading material, but maybe a few more details. And I think that will help a little bit too there. Okay. All right. Well, let's move on to the next one, which is rulemaking. Consider adopting a repeal of Rule 252.4. Kenny, you are up again.
Thank you. I don't anticipate the next items to be near as lengthy, so I appreciate everyone's.
I don't know. This was kind of fun. It was sort of exciting. Maybe we should do this more often.
Sounds good. All right, let's turn to page 25. As Commissioner Beecham said, discuss adopting the repeal of 252.4. The Commission previously voted to propose this repeal at the November 18th, 2025 meeting. As a reminder, we proposed repealing this rule, which relates to charges for open records requests, because it is unnecessary. Statute and rules from the OAG sufficiently cover our responsibility regarding charges for open records requests, and we are not required to adopt our own rules on the subject. So this is essentially cleanup, kind of in line with some of the efforts from DOJ.
Instead of having ours, we just use the Attorney General's.
And our rules, our existing rules were the same as the Attorney General's. So anytime they were to make a change, we would have to then change our own rules to be consistent. So this is essentially
getting
just a
efficient.
cleaner way to operate. Notice of the proposed repeal was published in the Texas Register on December 5th. Again, comments requested by January 5th. We did not receive any comments on that proposal. Therefore, I have prepared for your consideration the adoption document on page 26 for publication in the Texas Register. You will see that it restates the justification that we gave at the time of proposal, and it adopts the repeal as previously proposed. My recommendation would be for the commissioners to approve this document for publication. Happy to answer any questions.
Any questions for Kenny? Otherwise, then I think we'd be looking for a motion to consider adopting the repeal of Rule 252.4. Ryan Henry makes a motion. Is there a second?
I will second.
Chip makes a second. There's a motion and a second. All those, any further discussion? Didn't want to cut them off. This was good last time. All right, there's no further discussion. All those in favor say aye. Aye. Any opposed say no. The ayes have it. All right, we'll move on to the next one here, rulemaking, consider concluding the statutory review of Chapter 252, administration.
Thank you. We're on page 27. This is, as Andrew stated, we started considering Chapter 252 and the rules that we discussed, 252.8, because of the 4-year chapter review. We previously voted to initiate that review in July, at the July 30th meeting. Statute requires agencies to review and consider for readoption each of their rules every 4 years. We have historically reviewed rules on somewhat of a staggered chapter by chapter basis. We got two chapters in the same year this time. Notice of this review was published in the Texas Register on August 15th. Asked for comments on the general review within 30 days. In that notice, we stated that we had identified possible revisions to Rules 252.2 through .9. We did not receive any comments on that general notice. As you know, we then, at a later meeting, proposed the actual changes to those rules, and we have now dealt with all of those. Amendments to Rules 252.2 through 3, 252.5 through 9, and the repeal of 252.4. So having addressed all of those in the previous agenda items, the chapter review as a whole is now ready to be closed. It's 2 different documents we have to file in the Texas Register. The chapter review essentially will acknowledge our actions taken for the individual amendments and the singular repeal. So on page 29, I've prepared that document for your review. It concludes our review by stating the reasons for adopting the rules continue to exist, with the exception of Rule 252.4. And it acknowledges the separate amendments to Rules 252.2 through 3 and 252.5 through 9, the separate repeal of 252.4, and for Rule 252.1, it readopts that rule without amendment. I recommend that the Commission vote to approve that document for publication and would be happy to answer any questions.
Okay, Kenny, humor me on this one. So we got to send another deal saying that we're done doing all the reviews of the 252s then, essentially.
We do. Some agencies handle it
A
in...
little bit more here. If we didn't do that, would it just mean that we're open-endedly continuing to look at 252?
That our chapter review would expire after 6 months. You're allowed to initiate the rule review, and then you must conclude it within 6 months. Otherwise, it expires, and we would have an incomplete on our report card.
All right. Okay, sorry. It was a little esoteric. I just had to ask. Okay, Kenny wants us to conclude the statutory review of 252. Would anybody like to make that motion?
I will make that motion. Van Steenberg moves.
Thank God, Chip.
Don't want the aye.
Let's hold back for another 4 years on this one. Chip made a motion. We conclude the statutory review of Chapter 252. Is there a second?
Gross seconds.
Amen. Any further discussion? There being none, all in favor say aye.
Aye.
Any opposed say no. The ayes have it. All right. And as if just to continue the torture, here comes 253.1 and 253.3 through 5, adopting amendments to the rules.
The good news is that you don't have to think about these for another 4 years. All right, so we're on page 30 now. As you're aware, we previously voted to propose these amendments at the meeting on November 18th. Notice was published on December 5th. Comments by January 5th. We received no comments on any of the proposed changes to Chapter 253. So therefore, I've prepared for your consideration the adoption document on page 31 for publication in the Texas Register. It adopts all of the amendments as proposed without changes. These were largely cleanup amendments. My staff report goes in a little bit more detail if you'd like to review that. But my recommendation here would be to approve the document for publication, adopting them as proposed, and I'd be happy to give more info or answer questions.
Any questions for Kenny? If not, we would entertain a motion to consider adopting the amendments to Rules 253.1 and 253.3 through 253.5.
Sawyer, so moved.
Clint makes a motion. Is there a second?
Gross seconds.
There's a motion and a second. Any further discussion? There being none, all in favor say aye.
Aye.
Any opposed say no. The ayes have it. And now Kenny's going to want us to conclude the statutory review of Chapter 253.
Guilty. Page 32, conclude the statutory review of Chapter 253, practice and procedure. I won't go through the whole spiel about when we initiated it, when notice was published, only to say that we did not receive any comments on the general notice, nor did we receive comments on the proposed amendments. We've dealt with all of 253. We can now close it and avoid that incomplete on our report card, continue to get all A's. So I have prepared the document for you on page 34. It will conclude our review, stating the reasons for adopting the rules continue to exist, acknowledging the separate amendments, and readopting the one rule we did not touch, 253.2, without amendment. I recommend that you vote to approve that document for publication.
Well, would anybody like to make a motion?
I'll close this one as well.
Chip makes the motion. Is there a second? On Washington seconds. Any further discussion? There being none, all in favor say aye.
Aye.
Any opposed say no. It is passed. Thank God. We don't have to kill any more trees today. Looky there. Thank you, Kenny. All right, we're going to move on to our 911 service program policy statement, or PPS, for considering the repeal of PPS 34, unexpended balance roll forward. Heather?
I'm after Heather, so I should just stay. I'll keep her company up here.
That's fine, but you
He's
kind of
making me
spooked us a
stand.
little bit at first, Kenny.
Sit down,
Just
didn't you?
FYI.
There's a lot of seats
I was going
over
to take
here.
a seat, but that's fine. Good morning, Commissioners. For the record, my name is Heather Barnes, Director of Programs. If you would please turn to page 35. CSEC's appropriation includes a rider that gives the agency the authority to roll unexpended balances for grant years from year 1 to year 2 of the biennium. PPS 34 provides procedures to UB and RPC's funds. The GAA's grant-making provisions in Section 4.02 say that grant funds appropriated for a particular fiscal year may be paid out in a later fiscal year only if the grant is awarded and treated as a binding encumbrance before the end of the appropriation year. Government Code 403.071 then limits how long those funds may remain payable, no later than 2 years after the end of the fiscal year they were appropriated. In other words, a grant may be executed in the year the funds were appropriated, and payments must occur within 2 years after the appropriation. The agency reviewed the current UB process and determined that the structure could be improved by utilizing a performance period and a liquidation period. This change would give RPCs greater flexibility and reduce the agency's lift in administering the contracts for 911 service, and also eliminate the need for PPS 34. The UB rider for the agency and the GAA would remain unaffected. The performance and liquidation periods are outlined in the staff report, and they align with the GAA's grant-making provisions in Section 4.02 and the Government Code 403.071B. 911 funds not obligated by the end of the performance date and not expended by the liquidation date would return to the Commission. The proposed changes were discussed and accepted by RPC leadership, and if the repeal is approved, the appropriate changes to the contracts for 911 service will be finalized and provided to the RPCs. Commission staff recommends that the Commission vote to approve the repeal of PPS 034 unexpended balance roll forward. Happy to answer any questions.
Any questions for Heather? All right, well, if not, we would entertain a motion to, to repeal PPS 34.
Sawyer, so moved.
Clinton Sawyer makes a motion. Is there a second? On Washington seconds. Any further discussion? Being none, all those in favor say aye.
Aye.
Any opposed say no. The ayes have it. Heather, thank you.
Thanks.
Oh my God, Kenny. Consider adopting amendments to, now it's 251, 251.2. There you go. Okay, Kenny.
Yes, sir. This one made everybody happy last time, so hopefully we can continue those happy vibes here. And this is the last time you'll have to hear me speak, which should also make you happy. We're on page 37. This is considering the adoption of the amendment that we previously proposed on Rule 251.2 concerning changes to 911 service arrangements. This one was not it did not come out of a 4-year statutory review. This was something that staff and stakeholders identified as a potential issue. We discussed that at the previous meeting. This addresses temporary geospatial routing and putting in some guardrails there. I think there was a little bit of discussion at the meeting where we proposed the amendment, and the commissioners seemed to be in agreement that that was a helpful change to our rules. So we proposed notice of the proposed amendment on December 5th in the Texas Register. We asked for comments within 30 days. No comments were received on that proposed change. And so therefore I have prepared for your consideration the adoption document on page 38. That would be published in the Texas Register to adopt the amendment as we proposed with no changes. And I would recommend that the commissioners vote to approve that for publication. And before then, I would happily answer any questions.
Any questions for Kenny? If not, I guess we would be looking for a motion. Let me get back down to it here. Consider adopting amendments to Rule 251.2.
Muscat, motion to approve.
Richard Muscat makes a motion. Is there a second?
Van Steenberg will second.
Chip makes a motion to second. All those in favor say aye.
Aye.
Any opposed say no. The ayes have it. All right. Thank you, Kenny. You slipped 3 different chapters past us today. That was pretty good on your point. There was a lot of billable hours there.
I appreciate it.
All right. Poison control program. We'll go to Grace. It's going to give us an update on the TPCN call taking solutions. Grace?
For the record, it's Grace Rury, Director of Information Technology. I'm here to inform you and provide an update on the call-taking solution for our Texas Poison Control Network, or TPCN. TPCN currently uses the Department of Information Resources cooperative contract to fulfill the phone service needs for TPCN. The agreement reached the end of its initial term in August 2024, and we've exercised both of our optional 1-year extensions. The current optional extension comes to end of term August 31st, 2026. This past October, CSEC conducted market research to evaluate alternative call center solutions. This was driven from feedback by our stakeholders who expressed dissatisfaction with the current provider. This is primarily due to recurring network outages. Through this process, CSEC identified Amazon Connect as a viable solution capable of meeting the operational needs and improving the redundancy capabilities of the network. DIR offers a shared technology services, referred to as STS, which allows state entities to procure technology solutions efficiently through pre-vetted, competitively awarded contracts. Amazon Connect is available through the STS program. Given the limited timeline and the scope of the transitioning the primary communication platform of the network, CSEC also sought implementation support. The STS program includes implementation support, of which CSEC has requested as part of this project. Through multiple scoping discussions, the project team has developed a high-level project plan to configure Amazon Connect to meet the needs of TPCN and its stakeholders. The project plan includes testing, training, and a structured transition from the current provider to Amazon Connect. This project is set to kick off next month with initial estimated go-live date of mid-April. Based off recent discussions with the RPCCs, or the Regional Poison Control Centers, the date may shift to mid-May to accommodate operational activities. This is informational only, but I'm happy to answer any questions.
Any questions for Grace? Grace, you've done a super duper job on this. That other one, aside from the fact that it was ending, had a lot of problems. And I know y'all had to go outside the box on this a little bit, and you did not have a
very long period of time to work from, but y'all have done an amazing work on this, and I think ultimately it's a better solution. And I actually think, if I remember correctly, it's a cheaper solution. I mean, I shouldn't say cheap, that's not good, but it's less expensive than the bad solution was. So that's a win. So thank you.
I appreciate it. Thank you.
And so are we committed to paying out the first contract through August?
We are.
Okay, thank you.
Any more questions for Grace? All right. Well, if not, we'll move on. James, you come on over here. Poison Control Coordinating Committee, consider the approval and the appointment of Heidi. Is it what?
Good morning, Commissioners. I'll try and be brief. For the record, my name is
You're going to
James
have
Johnson.
to say her last name, Jim. Because
Okay. I was just for the record. If you'll please turn to page 39 of your notebook. So this morning I will be presenting the staff report to recognize the reappointment of Dr. Heidi Boyce of the Department of State Health Services, or DSHS, to the Poison Control Coordinating Committee, or PC Cube. Health and Safety Code 777.008 established the PC Cube and provides for its membership composition. The PC Cube bylaws establish that members will serve 6-year staggered terms and be represented by each of the 6 poison centers, DSHS, the public, and CSEC. Dr. Boyd's term did expire on the 31st of August 2025, but she continued to serve as bylaws provide that members will continue to serve until they resign or they are relieved. Dr. Boyes is a trusted member of the PC Cube, providing valuable toxicological advice and liaison to DSHS, as well as other healthcare organizations and agencies. Accompanying this staff report is the DSHS recommendation for the reappointment of Dr. Boyce, with a term expiring 31 August 2031. The Commission staff recommends that the Commission vote to recognize Dr. Boyce as the DSHS representative on the PC Cube, and is subject to your questions.
any questions for Jim? No. I bet she's great. I just saw the last name and it threw me for a loop, so sorry about that. We'd entertain a motion to approve that appointment of Dr. Boyce.
Grow makes a motion to reappoint Dr. Heidi Boyce for a term to expire on August 31st, 2031.
Boy, what she got herself into, 2031. Is there a second?
Van Steenberg will second.
All right, thank you, Chip. There's a motion and a second. Any further discussion? There being none, all those in favor say aye.
Aye.
Any opposed say no. It is unanimous. Thank you, Jim.
Thank you.
All right, finally up, we have Dr. Baker is here today, and he is going to give our Poison Control Coordinating Committee presentation. Dr. Baker, welcome.
Thank you. Good morning, Commissioners. And for the record, name's David Baker, Central Texas Poison Control Center. In your packet are a couple of slides, but before we get to that, I want to really appreciate and thank all the CSEC staff. They've worked hard. We've given them a really hard time, without a doubt, and they've come through. So hopefully we'll have a really good phone system soon. So in your packet, you'll see some graphs, and one of the graphs I want you to point out is we had a 17,000 jump in exposure calls just this last year. That's unheard of. I'm trying to figure out why, because there hasn't been any major event that I'm aware of. I mean, we've had fentanyl, we've had different things, but I'm attributing it to our educators. They've really gone out of their way the last couple of years to try and figure out how to get to people. Mailers, billboards, all kind of things. I'm guessing awareness of what we're doing allows people to call us more often. That's my theory. I'm sticking to it. On the second graph, you'll see how many patients are being treated in the hospitals that we are aware of, poison exposure. That had a 4,000 jump also. Again, I don't know if it's just because we're so good at what we do that doctors keep calling us or whatever, or they're hitting strange things and don't know what to do with those things, so they call us. So that was an 8.5% increase over the previous year for exposures. And if you were to 10-year period, a 15% growth. If it was an investment in a stock market, I might take that 15%. And then in healthcare cases, increased 6.5% basically, or almost a 30% increase over the last 10 years. My coworkers wanted me to point out one major factor. 93.3% of those who call us, we get to keep at home. and save a ton of money doing that. And on that ton of money saved part also brings me to the next point, what is not on here, and it was embargoed at the time, I couldn't release it. There's a new report out from the RAND Corporation about the Poison Control Center impact, if you will, on savings. And it's $3.1 billion saved for the investment in the U.S. 16.77 cents per dollar invested. So if you just take the math, we're saving $100 million or $200 million biennium for the people of Texas.
Mm-hmm.
So that's all I have. Any questions?
Good job.
I don't have any questions, but I appreciate the information, particularly with regard to the healthcare facilities and those cases coming in. I know when this comes up before the legislature, they look at they really think of the program from the kid got up under the sink and ate a Tide Pod or drank some bleach or whatever.
Right.
And I know this got talked about last time, I think it was in Senate Finance, about there's really a lack of understanding of how many hospitals are calling into the poison control centers for toxicology advice. And I rate that back to used to toxicology programs were pretty standard. And I think a lot of those folks coming out in the medical profession today have really not had that. And so, but I think this is important, and I think this is something y'all need to be playing up. We probably need to play up because, again, when they appropriate money, they're thinking about this, and don't shoot me on what I'm going to say. It's a call center where you call for help.
Right.
And they're not understanding the point of medical facility to medical facility toxicology advice. And that's a big part of what y'all do.
We all of us teach medical students as they come through. Big part of it. It's one of those missions we always have taken on. I'm not sure some of our centers wouldn't have still be there if we weren't teaching those medical students, because that's the value to the host institution that we're at. But you're right. A lot of these are falling by the wayside because there's so much information they have to learn as doctors. It's just easier to call us. So.
A couple questions, if it's okay.
Yes, sir.
On your two graphs here, on your final column out there, where the 17,000 increase, that's a good thing?
Well, it depends how you look at it. Part of our job is to keep ourselves out of business, but we haven't been successful. So I look at it as an awareness thing. They're more aware of us, so they call us more. That's another mission we have with our educators, is to make sure everybody's aware that we're here to help serve. So I'm looking at it as an awareness issue. I can't think of any trend that drove up 17,000 exposures on a Tide Pod thing or a bleach thing. So I don't know really what any one thing would have driven that much volume other than education.
Okay. And then on your graph with the case, I guess it's cases by year, this is 64,000 people calling in? Or is
There was 64,000 patients were treated in a hospital.
Okay. So 100 and
About a third of our volume is hospital cases.
that's the correlation there. Of your number, 198,000, 64,000 went to the hospital. So you're saying 2/3 of those got to stay home.
Correct. But although there's two factors here.
There's the people that are calling him
Yes,
in the poison control centers, and 93% of them stay at home.
correct.
That second graph, Clint, are where somebody's already at a medical facility, went to an emergency room, and the doctors in that emergency room need toxicology advice for that patient and call them then.
Okay.
You're hired.
Okay.
Perfect.
Very good. Okay.
Sure.
Dr. Baker, we always appreciate you. I do think one thing on that second one, again, not to extend this, but I assume y'all spend a lot more time on the calls for a medical facility because they're already a hospital. It's evidently far more serious.
Yes, sir.
And it might be kind of interesting to figure out what you spend time-wise on just me calling in, hey, I tried a little ivermectin. It's really kind of a great flavor of that apple thing, versus when a doctor calls in and how much y'all spend on that. Because I think that would be something easier that we could show that, hey, even though, there's these number and it's going up,
but they have to spend a lot more time on those cases and those toxicology.
Yes, sir. But it's about 2 times as long, at least 2 times as long on the initial call. Then there's follow-up calls that also require more time with hospital patients where if you ate your ivermectin, I wouldn't necessarily call you back. You know.
He knows. All right. Well, I appreciate that. That's helpful. Thank you.
Thank you, sir. Thank you, everybody.
All right. Anybody got anything else today? That being said, I really appreciate all of you. We agree, disagree, whatever. It's always good discussions and we do good work. And you know what? Today, we repealed a PPS and we got rid of a rule. So we're just like the model of efficiency today. Thank y'all. Is there anybody here that'd like to make a motion to adjourn?
Sawyer will.
There's motion. Is there a second?
Grove seconds.
Any further discussion? There being none, all those in favor say aye.
Aye.
It's unanimous. Thank y'all.